Data from Vancouver Coastal Health and Fraser Health shows that BC nurses have been paid more than $70 million a year in overtime, on top of their regular salary. Vancouver Coastal Health's top overtime worker from 2014 worked an extra 1,541 hours. That's another 3/4 of a work year on top of a work year you're already working. Those hours added up to about $125,000 in overtime, which works out to about $80 an hour. Another staffer worked in excess of 1,172 hours, which rings in at $98,500 in extra pay, about $85 an hour. These overtime hours are made up of straight time followed by a premium at time and a half or even double time. But why are these nurses working so much? It's because they're all specialty nurses, meaning they work in intensive care units, trauma and cardiac wards, or operating rooms. They say that the overtime is time that desperately needs to be filled. If someone calls in sick, they have to be replaced to meet staffing levels and ensure patient safety. So that often means calling in nurses on their days off or even asking them to stay for a second shift when they're already on shift. And while overtime and 16-hour shifts seem to be the new norm for the nursing industry, it's definitely not the best thing, because fatigue builds up, which can lead to burnout or even error. But with such low staffing levels, racking up overtime is something the health authorities just can't seem to avoid.